Hello, good evening, and welcome to another discussion program of Renewing the African Mindset, otherwise known as RAM. Renewing the African Mindset is an open platform where we create awareness on topical issues which the African community hardly talk about in the open due to traditional values and cultural beliefs. It's also a platform where we share views and experiences. It's a platform for collaboration of agencies or individuals for positive achievement. Also, it's a platform where we celebrate success stories within the African community. Today, we're going to talk on a subject which a lot of women hardly talk about due to the fact that some people think the situation or the condition doesn't exist. And the topic for today is menopause. Some people have not experienced menopause at all, whilst some people do. And the reason is because um, they think maybe it's a myth, it doesn't exist. Some people think it's a fact. We have professionals here today to inform us, to educate us whether menopause actually exists. And we'll be talking about the symptoms, we'll be talking about the causes and the treatment available. We have top gynecologists amongst us here today. We have psychiatrists because some people think maybe some women actually have mental health issue. And then some people do not believe in modern medicine. They rather go for traditional medicines. Some people believe in both. So today we're going to try as much as possible to cover different perspectives to the discussion here today. So the first guest that I will introduce to us to tell us what menopause is all about is Dr. Faye Iketuboson. He actually received his medical education at the College of Medicine, University of Ibadan in Nigeria. He proceeded to the United Kingdom to complete his training in obstetrics and gynecology. Whilst in the UK, he worked extensively in the areas of general obstetrics and gynecology, menopause, infertility, assisted reproductive technology, and endoscopic surgery. He obtained the membership of the Royal College of Obstetricians and Gynecologists in 1989 and is also the fellowship of the same college. In 2006, he established the George's Medical Center in Lagos, Nigeria, where he is the medical director. He was elected to the fellowship of the West African College of Surgeons in 2016. He's a member of several professional organizations, some of which include the Society of Gynecologists and Obstetricians of Nigeria, otherwise known as SOGAN, the European Society for Human Reproduction and Embryology, and the American Society for Reproductive Medicine. Dr. Iketibosu is the immediate past president of Association for Fertility and Reproductive Health. He also chairs the Data Registry Committee of the association and is a member of the Lagos State Government Committee on ART, which is Associated Reproductive Technology Monitoring. Popularly known as Dr. Faye, please welcome Dr. Faye Iketibosu. Hello, Dr. Faye.
Thank you very much for me. It's a pleasure to be here with you.
Thank you. Now, we keep on hearing the word menopause. Some people have never heard of it, some people have, but they've never experienced what I personally have experienced with millions of other women. So, we're going to start from the basics. How would you define the word menopause?
Okay, now menopause literally means when the periods stop. And that means, and it's by definition, it's when a woman hasn't had any periods for 12 calendar months. She is said to be in the menopause. And some women go through menopause naturally, well, most women. Um, some have it surgically induced through operations like hysterectomy, which means removing the womb and the ovaries. And a few will go through menopause as a result of um, taking medication, cytotoxic drugs, drugs for cancer, for example, which may damage the ovaries. So there are three pathways through which women go through menopause, but the majority of women will go through menopause naturally. Now, when we talk about menopause, we often refer to the symptoms. There are symptoms that are associated with the menopause that generate discussion. And these symptoms actually start before the periods stop. And so that period of time, which can be up to 5 years before the periods stop, is known as the perimenopause. And we tend to use the two terms interchangeably, but strictly by definition, menopause is when the periods stop.
Okay. So, is it a disease or a condition?
It's neither. It's a natural. It's natural. Through women, um, if you live long enough, will go through menopause. That the periods will stop, and this is very important in our society, in our community, because the life expectancy in our country is increasing. And so many more women will be living a significant part of their lives in the menopause. And so we're going to have increasingly larger number of women experiencing symptoms. And it's important that they know where to turn to if indeed they do have symptoms.
Right. Um, you mentioned induced menopause. Are you trying to just let us have a bit of clarity on that again? What's induced menopause?
What I said, that menopause can be induced, okay, can occur as a result of an operation. Some
Right,
women will have an operation to remove their wombs
right,
along with their ovaries. And a
right,
very common reason for that in our environment is women who have large fibroids. So
right,
that tends to be a reasonably common indication for removing the womb. And if they're over a certain age, 45 or thereabouts,
right.
the surgeons tend to remove the ovaries, and that straight away puts them into menopause.
Okay. Now, what's the usual age to start experiencing menopause?
Well, in the average age for menopause, it's 51, 52. Although there are racial differences. In our environment, it is not uncommon to find women going through menopause in their late 40s, 48, 49. But
Right,
the symptoms of the perimenopause, which is what causes concern, usually start in their mid 40s.
right. So when you say our environment, which environment are you actually talking about? Because we have diverse audience here. Is this UK? Is it Africa? Where exactly?
I'm referring to Nigeria, where I'm speaking from.
Okay, all right. Now, what are the causes of menopause?
Uh, menopause is a natural event. All right. Um, it's, a, it's a result of the ovaries failing.
Right,
Women, uh, a girl child is born with the eggs she needs for life in her ovaries. And
right,
every time she has a period, a certain number of eggs are committed.
right,
And this goes on and on and on until the ovaries are exhausted of their eggs.
right,
And consequently, estrogen levels fall, and so as do progesterone levels. And women then go through menopause. The periods stop, and they are said to be in the menopause. So it's not it does it is a naturally occurring event, and if women live long enough, they will surely go through menopause.
So how long is long enough?
Sorry, I didn't hear that.
How long is long enough?
If you live over the age of 50,
Right.
remember that life expectancy is not, it's quite commonplace to find women living well into their 70s and 80s and even sometimes 90s now. This
Right.
wasn't the case about 30 years ago. So there has been with that change, you're going to see more and more women spending a significant part of their lives in the menopause.
Right. Um, what are the symptoms, the signs that one would see or feel to know that one is menopausal?
The most dramatic symptoms that women would experience would be the hot flushes, or as the Americans say, the hot flashes.
Right.
And this is a sudden feeling of intense heat, which spreads through the chest and onto the face, and usually ends in a sweat.
Right.
And this can be very, very embarrassing. This is the most dramatic
Right.
because in our environment, Nigeria, which is a hot country, and we're used to sitting, working in air-conditioned rooms, um, it's very embarrassing for a woman to suddenly break out in a sweat, and sometimes the sweat is so intense
Mm.
that her blouse gets wet. So that's the most dramatic. It's also accompanied. You also have night sweats where you have a situation where um, you her nightie gets wet at night, even though the room is nice and comfortable. But she breaks out in a sweat. The nightie gets wet. She gets up to change it. She feels cold. She gets comfortable, another sweat, and then that leads to a sleep disturbance. And then that has the knock-on effect, and that is that productivity at work can be affected. So those are the most dramatic symptoms. But there are symptoms that are psychological symptoms like nervousness, anxiety, depression, impatience, feeling like being alone. And you have symptoms referral to the skin, dry skin, the nails becoming brittle. You have symptoms affecting the genitalia. You get the bladder shrinks and you get passing urine more often, and so on and so forth. There's a whole mirage of symptoms. And the reason for that is because estrogen, the hormone that keeps women as makes women women, is affects almost every single cell in the body. So the effect of deprivation of estrogen is referable to the particular system in the body that is deprived.
Right. I'm going to talk to you about some of the symptoms that I have here. Right about 40. Of course, you mentioned the major ones, but there were some strange ones which I noticed, and I would also speak from personal experience. Allergies, something that never used to be an allergy to you, all of a sudden you have some sort of allergies. And then ringing ears. I mean, I had to consult an ENT surgeon when I started having ringing in my ears, which I think they call tinnitus. Oh, and I thought this even actually happened during the COVID period, around about the onset of COVID, around about March, and I thought actually I had COVID, and I started steaming my ears. Strangely enough, even though I'm educated, until the ENT surgeon had to tell me that I could be causing more damage. And then some people talk about electric shock feeling. So, does it depend on the individual, or it's synonymous with a particular race?
Clearly, there are different manifestations of the menopause in different women. Some women have very mild symptoms, some have very, very severe, and there's a whole spectrum in between. Now, things like tinnitus, I haven't come across as one of the symptoms of menopause, but neurological symptoms are that symptoms that are referable to the nervous system.
Right.
You can have those as part of the presentation of the menopause. Memory loss, or yes, loss of memory, is also one of the common symptoms where women become very forgetful.
Yeah.
So there are typical symptoms and there are what we call atypical symptoms.
You're right. Um, there is also one which some people have shared with me, like vagina dryness, painful intercourse.
Yeah, yes, that's quite a common symptom because the estrogen provides support for the vagina. The vagina is as when women go through the menopause and the vagina loses its estrogen stimulation, it
Right.
becomes quite thin.
Right.
And as it becomes thin, your intercourse naturally becomes painful. It also shrinks in size. So
Right.
you can have painful intercourse. You can also have bruising as a result of that.
Right. So, would you say symptoms actually change with age?
Well, the symptoms don't appear all at once.
Okay.
So, like I said earlier, the hot flushes and sweats are the most dramatic. Those are the ones that you notice first, and the majority of women would experience those symptoms, and because they're very, very alarming. The others are more long term, and there is no time frame in which they may occur. You can't put a time frame as to when any particular symptom will occur, but in the fullness of time, not everybody would have the same symptoms,
Right.
but all the symptoms you describe are recognized symptoms that women would experience.
Okay. Um, what does this terminology mean? Perimenopause.
Now, the perimenopause is the period of time before the periods actually stop.
Right.
Now, this can be anything from 2 to 5 years before the periods actually stop, when women begin to experience some of the symptoms. Some women begin to have hot flushes in this period of time, and this continues until the periods actually stop and beyond. So it isn't actually a defined period in terms of time, because
Right.
every woman is different.
Right. Okay. What about this menopause belly?
Menopause belly. Well, that's a deposition of fat
Right.
in the belly,
Right.
in the lower belly, below the belly button.
Right. So once you start having the menopause belly, what happens? Because some of us seem to fall into that category.
I think one needs to be careful about the what you describe as a menopause belly,
Right.
because there are a number of the fat deposition in the lower abdomen is quite common,
Right.
and if it depends on a number of factors. Diet, for example, exercise. Not all women would develop a menopause belly as you describe it,
Yeah.
um, but women tend to they're because of the it is quite a common complaint in our environment.
Yeah.
Uh, but then in our environment, the body mass index, we're not actually a very slim population here.
Right.
So but and at some point, women become very conscious of their bellies. Here, we in our traditional attires, they tend to be quite give us enough accommodation
Right.
for growth in certain areas of the body.
Yes.
So but I mean, I have had a number of women complain that they've put on weight in that area and they find it difficult to shed.
Mhm. Okay, let me just read a bit of the or the symptoms, because somebody's been sending some information to me so that other women and men listening, would understand. Hot flushes, which you talked about, the mood swings, night cold sweats, hot flushes or flashes, headaches, palpitation, hair falling off, growing facial hair, brittle fingernails, which you mentioned, difficulty in sleeping, insomnia, joint stiffness, aches and pains, reduced muscle mass, recurrent urinary tract infections, vaginal dryness, which I mentioned, anxiety, reduced sex drive, problems with memory and concentration, weak bones, which probably leads to osteoporosis, stress, irregular periods, dry skin, weight gain, loss of breast fullness, thinning hair, slowed metabolism, dizziness, bloating. Maybe this is where the belly menopause comes into play. I don't know. Breast pain, digestive problems, irritability, allergies, which I mentioned, depressive mood, painful intercourse, which we mentioned, itchy, crawly skin, bleeding gums, chronic bad breath, ringing ears, which was mentioned earlier, electric shock feeling, sore breast, clammy feeling, burning tongue, and also at the roof of the mouth, and then vertigo. You know that everything is just spinning around you. And from what one of the doctors actually mentioned at one point in time, that is still different from you feeling dizzy. So these are all uh, the symptoms. So not everybody will encounter the same symptoms. You said, Dr. Ofai. Not
Absolutely.
everybody will. Yeah. Okay.
You,
So
you see, the list is so long,
right.
as you can see.
Yeah.
Um, so I mean, it just and that's because estrogen affects every part of the body.
Right. Um, you mentioned the fact that one could have induced menopause. Is menopause reversible, particularly when a woman is yet to experience motherhood? Is it reversible?
No, it's not. It's not reversible. Um, once your periods stop as a result of, I mean, the periods can stop for different reasons, but
Right.
once your period stop as a result of your ovaries no longer functioning, that's an irreversible process.
Okay. So, are there differences between African and Caucasian women with regards to effects of menopause?
Yes, there are differences, and but I think that the number one difference is, I would say, is a cultural difference, because in African populations, when women go through menopause, and in a lot of situations, they are just told to just carry on. It's something. This is another phase in your life, and so just get on with it.
Right.
Now, and hitherto, there hasn't been a lot of discussion about these symptoms, even amongst women. Talk less of coming to see a doctor. But I think that is beginning to change now, because particularly in urban areas.
Mm-hmm.
Now, the other thing is, because we are um, we're not a very slim as a population, and we tend to be slightly on the plump side in general, talking in general. By the time we get into our 50s,
Yeah.
we have a lot of fat tissue. And
Mm-hmm.
so fat tissue has the capacity to make estrogen,
Right.
weak estrogen.
Right.
Sometimes, if there's enough fat, you may not have very acute symptoms of the menopause, like the flushes and the sweats.
Yeah.
Um, so there may be some difference in the symptoms that our women will present with.
Yes. Okay. Let's hold it right there, Dr. Faye. I want to bring in a different perspective. Well, not really a different perspective, because she's also, a gynecologist and an expert in menopause. So I just want to have an idea of what she feels from the UK perspective. She's a graduate of medicine from the University of Cambridge and trained at St. Thomas's Hospital. She's a fellow at the University of Toronto, Canada, where she completed her research and was awarded a medical doctorate by the University of London. She's a member and fellow of the Royal College of Obstetricians and Gynecologists. She worked at St. Thomas's in the specialist menopause clinic. She is certified as a menopause expert by the British Menopause Society. She's an accredited gynecologist to the 2012 London Olympics and works as a specialist advisor to the English Institute of Sport. Please join me in welcoming Dr. Kate Panther. Dr. Panther, thank you for joining us at a very short notice.
Hello.
Very much appreciated. You heard what Dr. Faye said there. He's based in the United
Mhm.
sorry, he's based in Nigeria, also trained in the UK here. He mentioned something about the environment. Of course, now you know the environment is Nigeria. He said from age 48 or thereabout. Would you say that's the case in the UK here when menopause sets in?
I think you mentioned that for the perimenopause. So that was when you start. So the average age of the menopause is between 51 and 53, which I agree with.
Yeah,
And that's the date of your actual date of your last period. But
yeah,
women experience symptoms up to sort of 5 years or so before that. So although the date of the last period is when you is a finite time that you can mark in your calendar,
right,
the ovary doesn't just suddenly neatly stop. It's not like a switch you can turn off. It kind of malfunctions in the years leading up to that. And so in your late 40s, you may notice subtle changes. So your periods may change, they may get heavier, their cyclicity may change. It may not be a perfect regular cycle. And those are all signs that your ovaries are starting to not work quite so smoothly.
right,
And what happens at that time is our body stimulates the brain, stimulates the ovary to respond, and you get elevated FSH levels.
right,
So that's the perimenopause. I mean, there are cultural variations in the age at which women go through the menopause, and it's earlier in some parts of Asia. I know. I'm not sure about Africa actually, but in certainly in Caucasian women, it's 51 to 53.
but we've had cases whereby some people were, experience menopause in their 30s without having ovarian cancer. What could have been the case?
So that's generally now called premature ovarian insufficiency. And it's really, really important to pick up. So some girls, periods will stop. At the guys' clinic, we sometimes see women as young as sort of 18 or 19 who've barely started their periods. Some of them won't have had children. And we're not quite sure what causes that, but it may be autoimmune. If it's, I mean, we would look for genetic causes, autoimmune causes,
Right,
where the immune system may attack the ovary. And in some cases, we just don't find, that iatrogenic, we don't find. And as your Dr. Fay said, it can be associated with treatment for cancer. In those
right,
very young women who get cancer, you may have heard in the last year or so in the news that sometimes we take some ovarian tissue out to harvest it, so that when they have their cancer treatment, which otherwise kills the ovary, their ovaries are frozen and then they can be reimplanted afterwards to maintain some fertility. But premature ovarian insufficiency is very important to pick up because those young women should definitely be offered hormone replacement treatment up to the average age of the menopause,
right.
because otherwise their body undergoes all the changes of the menopause much, much too early in their life. So their bones, their cardiovascular system, and as Dr. Fay said, there are estrogen receptors all over our body. And if that change happens to the end of your life, then hopefully your bones will be strong enough to maintain their strength so you don't suffer consequences of osteoporosis, which is weakening of the bones.
Okay. Um, well, let's talk a bit about why do some women experience menopause and others do not?
So I agree with Dr. Fay. I mean, everyone experiences menopause because we define it as the date of your last period. So unless you die very young, so naturally as human beings, there's only us and three whales that actually go through the menopause. Most animals die. They die before they go through the menopause. But it may be that human beings now, if their sort of biological lifespan, that we live much longer than a creature of our size. And that's one of the theories about menopause. And so everyone's periods will stop at some point if they live long enough, but it's you get symptoms. So the most obvious symptoms, as Dr. Fay said, are hot flashes and night sweats. Those are the ones very often that women notice that they're alarmed by. Also, as you alluded to, emotional variation, so mood change, anxiety is very often a problem, and often change in their periods and their bleeding pattern.
Okay. Why do some women see their monthly period again after maybe about 6 months. It stops, then it
So
starts
that,
again after 6 months. What do you think?
yeah, so that's what I was saying, that the ovaries sort of doesn't just neatly switch off, it sort of put, and fizzles out. So it'll stop, your periods will stop for a few months, you may get hot flushes and night sweats, then you may have a good month, if you like, ovulate, make an egg, release the egg, and that releases estrogen. And then your symptoms will go away for a little bit, but then that can come for a few years around the menopause, where you'll get symptoms. You may get the odd period, but it has to be remembered that if you've actually stopped your periods for a year, you then have to be concerned about bleeding that comes after the menopause, because that may not be physiological, sort of natural bleeding to do with your cycle. That could actually reflect some sort of gynecological cancer or some other problem. So postmenopausal bleeding is different, and that needs to be flagged up to your doctor.
Would you say that life events actually predict severity of symptoms in peri and post menopause?
So you mean your resilience? So an adverse life event might affect your resilience.
Yeah.
I think how you perceive yourself. I mean, menopause is not just a biological event; it's a psychosocial event. So for some women, um, they understand the menopause in terms of the end of their womanhood, their reproductive capability, and in women in whom, you know, they've had children, very often their children are moving away and they're grown up, they may be going to be a grandparent, although increasingly in modern society that actually happens sometime later. So I think depending on what factors are very important to a woman, she may perceive it as a very much a psychosocial event. And obviously, if you're very anxious about something, then there's very good evidence that your symptoms will be more severe. And actually, CBT has been found to help women deal with the menopause and deal how, you know, the relationship between what they think, how they feel, and how they behave. We know that's really profoundly important. So, you know, if you have beliefs about the menopause which are negative, then you'll probably experience the symptoms much more severely.
Okay, we'll stop you right there. Let me just quickly, because both you and Dr. Faye were talking about the psychological effect, mood swings, and things like that. I want to bring in a psychiatrist here, and I just want to find out whether there is some sort of correlation between menopause and the depressive mood, whether it has a bit of issue with mental health. So I'll bring in Dr. Toyin briefly. Dr. Toyin Magbabiola, let me ask you this question: does menopausal transition really influence mental health?
Yeah, good afternoon, everyone. Thank you for having me on. Yes, it does for certain people. Like Dr. Panther said, there's a psychosocial part of it, and there's also the psychological aspect of menopause as well. For people who may not recognize it as a mental illness, because some of them might present initially to the GP with mood swings, low mood, depression, and you just can't put their finger on why they're actually experiencing these symptoms. And sometimes GP, with the nature in the UK, because the woman is very concerned, may start them on antidepressants, and they might actually go on multiple antidepressants, which don't work, until they actually take a closer look to actually look at the age and think, oh, she might be going through the menopause. And that's when they now start looking into the menopausal aspect of their presentation, and then may have to be on replacement therapy to help elevate the psychological symptoms that they're actually experiencing.
So would
What
you
is also good to know, because I work with adults with learning disability, and I think a lot of the time when people talk about menopause, they kind of not think about people on the learning disability spectrum, but they also do go through menopause, but their presentation is totally different. And most times they probably present with things like challenging behavior. And only when you actually acknowledge the age and then you start to think that they could be going through menopause, that will be looked into. So yes, it does affect you. So mood swings, depression, and yeah, it does affect.
so in other words, would you say that menopause is one of the risk factors for depression or that causes depression?
I won't say risk factor, because some people can gladly go through menopause without actually having any psychological symptoms. They
Right.
just hobble along, they live with the hot flushes, and they're kind of psychologically ready. And I think that's what is important. If you're psychologically ready that at a certain age, your period will stop and there might be some symptoms, then you stand a better chance of not actually going through the psychological aspect of it. But if it's something that you never thought about and were not aware of, then the chances that you might think it's a sinister thing happening to you, and especially in our culture where mental illness is not something that we actually talk about,
Right.
then it becomes a big issue.
Okay, right. We're going to talk about the treatments. Thank you so much, Dr. Toyin Magbagbiola. Just as well that we didn't put your face on the flyer, because once people see psychiatrist, everybody will probably think, oh my goodness, I have menopause. And it probably means I'm going a bit cuckoo in the head. No, that's not the case, because I also fall into that category as well. We're going to talk about the treatments. But before we do, I just want to quickly bring in a GP. She's actually a family physician with over 3 decades of experience in pediatrics, family practice, female reproductive and sexual health, diabetes, general practice, education, and training. She's a graduate of the College of Medicine, University of Ibadan, a member of the Royal College of Physicians and Royal College of General Practitioners in the UK. She returned to Nigeria after 25 years practice, having worked in different tiers of hospitals and across various specialties. She left the UK as a GP trainer, appraiser, and safeguarding the lead of a large practice in Essex. Um, Also, now she's currently the medical director and lead clinician for New York Medical Center, which is actually based in Lagos, Nigeria. The facility actually provides international standard of healthcare across all specialties for everyone. Please join me in welcoming Dr. Toyin Adenaike. Welcome,
Thank,
Dr. Toyin.
thank you. Thank you very much, and thank you for having me.
Thank you for accepting our invitation. As a GP, family doctor, or physician, as they might call it in the United States, who has practiced both in the UK and Nigeria, do you find any difference in the way you are approached when it comes to menopause?
Yes, absolutely. It's actually quite different. And I agree with a lot of the things Dr. Faye has said about it. So in Nigeria, a lot of the times the women don't recognize their symptoms as symptoms of menopause, particularly in the perimenopausal period, because a
Right,
lot of people are not aware that the perimenopausal period can take anything between 2 to 5 years, as Dr. Faye said. So
right,
when their periods become irregular, when they start to get the hot flushes, the mood swings, the vaginal dryness, the low libido, they
mhm,
don't always associate it with menopause.
right,
Um, the other important thing to talk about regarding Nigeria is I find that the psychological effects are actually quite different
mhm,
in women in Nigeria because again, mental health is not something we're very open about. So
right,
as a GP, it's something that I always have to have at the forefront of my mind and
right,
create a safe space to have that discussion with them in terms of how it is affecting them.
right,
What I also found interesting in Nigeria is that the women present much later in age than when I was in my practice in the UK. So in
right,
the UK, as soon as women start to get irregular periods and
mhm,
they're getting symptoms, they would readily come forward and
right,
discuss how they're feeling. I
right,
guess because in the UK, obviously we have the NHS, we don't have something like that in Nigeria. So
right,
until it actually becomes a big problem,
yeah.
that is when they would then present, or when they start to worry that their symptoms might be something more sinister like cancer and so on. And that's when they would then come forward and discuss their symptoms.
So, in other words, are you saying that when you're dealing with the patients in Nigeria, you are a totally different kind of GP with a different mindset, with the typical African mindset, in order to elicit information from them?
Absolutely. In fact, I wear two hats when I'm in Nigeria because I practice in Lagos, so there's a large expatriate community.
Yeah.
There's also large community of people who have lived in other parts of the world, relocating back home, but also the indigenous Nigeria people. So we have a really Lagos is very cosmopolitan, so there's a mix. But I need to wear both hats most of the time because you just don't know as GP practices, you don't know who's going to walk in next, and you have to be prepared for both scenarios.
So, what do you actually look for to ascertain that the woman needs to be referred to a specialist?
So the first thing is, as you listed out, you can see how many symptoms. It's a myriad of symptoms. So as a GP, I need to sieve through all of that. Because what we haven't mentioned is around the time that women experience menopause is when a lot of other things also begin to be obvious in their, become a health problem. So an example is thyroid. We find a lot of middle-aged women tend to have thyroid problems, and the symptoms can be very similar to what you will present with if it was menopause.
Right.
So the same as Dr. Toyin, my namesake, just said, with the psychological symptoms, sometimes it falls within the period in their life where there are major life changes, bereavement, sick parents. They tend to be carers for their parents, other members of the family. So sometimes when they come with this myriad of symptoms, as a GP, you really want to drill down and go down the various paths to find out, is this menopause? Is this a psychiatric problem? Or are there other medical problems like a thyroid dysfunction and so on and so forth?
Okay. Let's hold it right there. I'm still going to come back to you. Dr. Faye, what are the treatments available for treating menopause?
Okay, now there are, okay, I'll start by saying that the most effective treatment for the menopause is replacing the estrogen the women are no longer producing. So estrogen replacement therapy is the most effective. Now, there are that comes in different, can be administered in different ways. It can be through tablets, which is the least effective. It can be through patches, creams, or implants. Now, if a woman has a uterus, hasn't had her womb removed, then she needs to have some progesterone, some kind of progesterone for at least 10 days in the cycle so that she can have a bleed because so that's what that protects her from developing cancer of the lining of the womb, or what we call endometrial cancer. Now, so that's the most effective treatment. But I will say that not every woman will be suited for or even inclined to have hormone replacement. And one of the challenges is that there's been so much misinformation about estrogen or hormone replacement therapy, and that it's often a challenge trying to convey to women the actual correct data. So, but then again, you do have other remedies. I see that we have an alternate practitioner on the panel who may be able to talk about, herbal remedies and or non-pharmacological remedies for some of the symptoms. But but the most effective treatment for the menopause is without a doubt estrogen replacement.
And that's HRT.
Yes, HRT.
Okay. Now, how would you know is the right treatment for each patient? Each patient you see.
Well, as a doctor, you take a history of, you need to establish, first of all, excuse me, you need to establish, first of all, that you're dealing with menopause. Like Dr. Twain said, thyroid disorders and there can be other comorbidities playing at the time. And also, you need to establish whether this woman whether she's suitable to receive estrogen. I give you one contraindication. If a woman has had an estrogen receptor positive breast cancer, she's not a candidate to receive estrogen replacement therapy. So you need to make a proper diagnosis and establish her suitability for the treatment.
Right. Okay. Now, what about treatments for available for women who have gone off sex and they have vaginal dryness?
Well, there are two solutions. The hormone that will actually improve libido in women is testosterone.
Right.
And, testosterone can be administered in different ways as well. Uh, in It's not licensed in all countries for hormone replacement therapy,
Right.
but where it is, you can give a combination of testosterone and estrogen.
Right.
Testosterone does two things. One, it does improve libido and all that, but also testosterone is also converted to estrogen in the body, and therefore and is able um, to is able to meet the needs of the individual tissues through a secondary mechanism.
Right. I'll stop you right there. Let me have a female perspective without sounding sexist. Dr. Panta, do you agree with HRT, given the fact that we hear all the time that it has a link to ovarian cancer?
I think for some women, HRT is really important and makes a huge difference to their lives. I mean, the reason I've become interested in menopause is because there are women who come whose lives are imploding. They've got lots of symptoms. They're not being able to work properly. They're not the best version of themselves at home. And HRT in those women makes a huge difference. And it's a very straightforward, quick treatment for those women very often, particularly if they're presenting like mental health problems. Treating those women with HRT makes a huge difference. I think at the end of the day, it's a woman's choice as to whether she has HRT or not. And it will depend on the symptoms she's experiencing, what she hopes to treat. And at 50 now, many women are still trying to work. They've got elderly parents, they've got quite dependent grown-up children. They want to go to the gym, they want to look good, they do want to carry on having sex. And for some women, unless they take HRT, that's not going to be a reality for them. But it's a very individual. And one of the things that we try really hard to do from the NICE guidance in the UK is to individualize care. So you have to look not only at her symptoms, you have to look at her medical history, her family history, and take into account all these different factors and try and give her a risk benefit for her for using HRT.
Right. You also mentioned something about CBT earlier, the cognitive
Yeah,
behavioral therapy. How would that actually work to lessen the
yeah.
effect?
So Myra Hunter at King's College in London has done a lot of research on CBT. And what we find, CBT, for those who aren't aware, is the relationship between your thought, your behavior, and your emotion.
Right.
And what we find, so if we use, say, a hot flush in a work environment, if when you develop a hot flush in a work environment, you think, I feel out of control, everyone's looking at me, I'm so embarrassed, those neuro pathways feed into the hot flush. So it's actually, you can prove that it's actually deeper, lasts longer, and is much more debilitating. And what cognitive behavioral therapy does is that trains your brain so that when you get the hot flush, you think more positive thoughts. You think millions of women have gone through this. There's nothing the matter with me. It'll be self-limiting. Probably no one else has noticed. And if you can train yourself to be kind, it's very often thought of as a, what would your friends say? Or what would Dr. Panta say? She'd say, it's not going to hurt you. It'll go away in the end. And if you can relax in a sense and train yourself to behave differently to the hot flush, it won't have such severe consequences. And you can show that women will be less bothered by the hot flushes. They'll still come, but they won't be so deep and they won't be so bothersome.
So, how effective are the vaginal estrogen creams then?
They're really effective and they're licensed in the UK for indefinite use. And what we know is that women in their 50s are not likely to come in and say these problems occur right at the beginning and may only come when it's late in the day. So it's really important that women are asked about these problems in the perimenopause. Is your vagina dry? Are you having problems with sex? And the vaginal estrogens have very few side effects. So they're licensed in the UK for indefinite use, and they'll keep the vagina So basically, by providing estrogen directly to the vagina, you don't have to take progesterone. It's a really, really low dose, but they keep the vagina and the bladder much more robust. They help it maintain its sort of premenopausal state, if you like. So it's really effective and very worthwhile to use in your perimenopausal and older women, particularly women, say, not only with problems with sex, but with recurrent urinary infection.
All right. Thank you very much for that. Dr. Faye, quickly, do you find it easy to talk to women? Well, I know you're a gynecologist, but then again, when you now tell them with regards to the vaginal cream, how receptive are women to that?
Well, funny enough, I've had women come in and ask for assistance in that regard,
Right.
because it does it can be very, very uncomfortable for those that have symptoms. So yes, I mean it's not we do get requests, but not very many, I would say. And when when we're talking about menopause symptoms in general, we would probe and find out, because we know that these are the common areas which women may not actually volunteer, but
Right.
we would then ask questions and get an elicit a response.
Right. Okay, thank you. Dr. Toyin, let me just quickly ask you this. Would you recommend herbal remedies or changing diets? Because, some doctors have suggested changing diet all the time in order to sort of like alleviate the symptoms associated with menopause. Would you recommend that, especially given the fact that you are now uh, in Africa?
Right. So I'm not into alternative therapy, and I know you have somebody on the panel who's an expert on that. But what I do as a GP, apart from making sure that there are no other reasons why these women are feeling this way,
Right,
is to advise them on simple things. So, like Dr. Panther said, we try to individualize the care, because
right,
no two women are exactly the same. No
right,
two women go through the menopause the same way. So
mhm,
really, it depends on what their predominant symptoms are. But
right,
also, I'm conscious that I'm in a resource poor environment, and
mhm,
some of the medications that I would easily prescribe in the UK are not always available. So
right,
even for instance, the vaginal dryness, I will start with simple things like, they shouldn't wash with soap, they should wear nice loose cotton pants,
mhm,
they should use lots of lubricants, water-based lubricants,
mhm,
and even simple KY jelly before intercourse. We
mhm.
advise simple things like be relaxed, a bit of cognitive behavior therapy. Don't dread having intercourse. Of it as something you're going to enjoy, something pleasurable, so you're not tense, you're not worried. And if I can, I always encourage the women to bring their husbands in so that they understand what is going on with their wives. So they're a bit more patient, they're a bit more gentle, and they can both work at it together. There are lots of other things that I encourage the women to try. Obviously, diet, good diet, exercise, keeping their weight down. There are lots of supplements that are available over the counter that they can use. But even some practical tips, like in Nigeria, I'll say, look, take a spare blouse to work, especially if it's an important day and you're going to have a meeting, you're presenting to people, because the psychological effect, as Dr. Toyin said, can be quite devastating. So simple things, take an extra pair of, top, have some face towels and things like that, or even let people know, people who need to know, because it is a natural process. And every woman, if you live long enough, is going to go through it. So, just demystifying some of the myths around menopause and the anxiety around it,
Yeah.
and so on. So just really simple remedies, a lot of reassurance, and a lot of signposting. And if I'm having difficulty, fortunately, Dr. Faye is not far from me, so I send the patients to him.
I actually have to confess this. There was a time he prescribed patches. They actually expired because I just kept on thinking, oh my goodness, ovarian cancer. And when I came back to the UK, this is a practice of six GPs. The men were saying, don't use it. The men were saying, go for it. So, Dr. Faye, I'm sorry, it's expired. I haven't used it. I'm just going to bear it and grin it. And it's been going 8 good years. So, anyway, hopefully, I won't find myself before we end this discussion. Now, one last question I have for you, Dr. Toyin. Why do you think some women think or find it very difficult to openly discuss menopause with their fellow women? When somebody asks me, why did you cut your hair? I said, my goodness, it's almost as if there was a hot cooking pot on my head. So I had to cut my hair. And a friend said, do you have to let everybody know you're going through menopause? Why? What's the problem?
Right, that's a very
Among
good
women, what's
question.
the problem?
That is a very good question, and that's an interesting and important thing I found in our environment. I think as people, we are generally very secretive, but the reason we're secretive is because we're superstitious and we're religious. So
Hmm.
we believe that if we say something, we
Right.
are giving it power. So
Mm,
we try not to say anything negative.
right.
It would interest you that I had to learn a lot of lingo and I had to adjust how I take history from patients in Nigeria because they will come in and say that they are feeling well. And I'll think, if you're feeling well, why are you here? And they obviously look unwell, but they don't want to say that I am ill
Mm,
or that I have diabetes, or because they believe that they're giving power to
mhm.
whatever that thing is.
Yeah.
So I had to coin different phrases of finding out some of these things, even including family history. Sometimes I have to, say, okay, is your mom alive? They will say no. How old was she when she died? Do you know what she died of? And they won't want to say it. And sometimes I'll say, okay, just write it down. I'll give them a pen, and because they just believe that they give power to it. So that's the first thing. The second thing is we have this ability, or rather, we believe as a people that if you give in to something, then it means you are weak. So if you're saying that you are having menopausal symptoms, you're basically telling people that you can't cope. And so these are some of the health education that as a GP, I have to go through and tell people that, look, it's normal, it's natural. Your best friend probably has it, she just hasn't told you about it. And if we, like what you're doing now, the more we talk about it, the more we're open about it, the better for all of us, not just as women, but our men too will have better understanding of what we're going through, and they can be more supportive.
That's
The third reason is we don't want to admit that we're getting old.
true.
Age is a big, in fact, as Nigerians, most of the time we reduce their age. So I have to say, when I'm taking history, is this your real age or your professional age? And I have to educate people to say, okay, as your doctor, I need to know your real age because it is so important so that I don't make a misdiagnosis or I don't give you treatment that is inappropriate. So these are some of the quirks that I have had to learn in my practice back in Nigeria. It makes life interesting, but it's yeah, that's who we are.
Thank you so much for that, Dr. Toyin Adenaike. You're learning from us, all the non-Africans, especially Dr. Panther. So we are creating awareness about our African mindset. Now, the next person I have here, following from what Dr. Adenaike just said, we have all these taboos. We have, Africa is so entrenched in all these cultural beliefs, traditional values, the culture of silence. Or, I mean, we go to the Chinese here for herbal treatment. But in Nigeria or in other parts of Africa, if you were to say that I'm going to the herbalist, the next thing they think about is you're going to a voodoo priest. So my next person here, it's she's focused on alternative medicine, traditional medicine. That's what she practices. And I will introduce her shortly to you. Quincy is the founder of the Herbal Slimmers and Weight Loss Association of Nigeria and the pioneer secretary general of the National Association of the Nigerian Traditional Medicine Practitioners. She established a not for profit organization called Self Employed Women Association of Nigeria, which focuses on women's entrepreneurship. Prior to establishing Quincy Herbals, she worked in a bank. Now, she resigned and decided to change her career by studying natural medicine from the Nigerian College of Natural Medicine, which is a subsidiary of Federal Ministry of Medicine and Technology in Lagos, Nigeria. She also studied naturopathy in the US and attended several seminars on the practice of traditional medicine in China. Um, Quincy is a World Health Organization expert committee member on the development of African traditional medicine and practices. She's an advocate for the integration of African traditional medicine into the healthcare system. She's popularly known as Quincy, and she is Nigeria's leading herbal healthcare center, which is called Quincy Herbals. She's the Chief Executive Officer of Quincy Herbals. Please join me in welcoming Quincy, Dr. Mrs. Quincy Olasumbo Ayodele. Are you there?
Yes, I am here.
Okay, she's here. Now,
Good
you heard
afternoon,
what I
everybody.
said. That you heard the intro. If you were to tell them, I'm a traditional practitioner within the African context. What goes on into their minds? I could, without mentioning names, I remember having a chat with a medical doctor that I'm bringing a herbalist, and the first thing he said to me was, "Haba,
Hmm.
herbalists." So, how would you describe yourself?
Well, I'm a traditional health practitioner,
Right.
a WHO expert committee member on development of African traditional medicine, practice practitioners and products, so that we're having natural things, we are having aloe vera in capsule, the dosage, the this and that. I happen to be the person that advocated for it right from the WHO. So, but things have changed now. Any orthodox or any other medical practitioners that is thinking that herbal is, oh, what is that? Is a taboo. It's not reading or it's not educating himself and it's not carrying himself along with the world, because the world now is going towards alternative medicine. There's no doubt about it.
Right.
WHO has told us several times, especially at this period, that there is no cure for COVID-19, and they have asked us to look inward locally for what can remedy it. And the Minister for Health of my own country, Nigeria, has invited notable practitioners like me to look inward for what we can do to remedy COVID-19. And we have planned into action, and then very soon that will be taken care of. So herbal medicine is no longer a taboo. And something I've been talking about since like 20, over 20 something years ago. I actually advocated for my people in Nigeria and Africa to accept the use of herbal medicine because of that the fact that it is that's the only thing that can actually be able to remedy a lot of situations. Like menopause we are talking about, we have a lot of cases, even in the traditional medicine practice, that they come like that. Oh, they're like in their 40s and they reach their menopause for the past 2, 3 years. Oh, we give them the herb. And of course, with what Dr. Fai and our other colleagues have said, you give them the herbs and the menses come back, it's irreversible in the traditional medicine world. We give them the herbs and they see their menses. You know what? They conceive and have babies. It's not a matter of voodoo. This is medicine. I'm talking of medicinal plants now. I'm talking of science of the plant and it works. You understand?
Yeah.
Herbs like a donqua that can actually be able to bring back the libido. Herbs like carrots that can actually is rich in vitamin A, and then herbs like kava to take care of the mental health of the patient, and so on and so forth. What about soya milk? Those are herbs. What about the yogurt? You understand? The soya milk, we call it in the traditional world as the queen of herbs.
Right.
So I always recommend for my patients that as soon as you don't even wait for menopause to come before you start preparing for it. From age 35, I place my lady patient on soya milk unsweetened if they don't have fibroids, because if you have fibroids and you are taking soya milk, that can also aggravate the onset of fibroids. So I place myself on it first. So by the time I reach menopause, I didn't feel it much. I am 61 and I cannot even say that this is the time that I experience hot flashes or this or that. Yes, maybe a little while when I was like 58 or so, you have the hot flashes, and black cohoes look after that. Looked after that. We have a lot of traditional medicine supplements or remedies, as you guys want to call it, that cures, that heals, and that take care of all these things that we are afraid of. My feeling is that to every disease, there's a cure in nature. So the earlier we go back to nature, let us begin to research more and more and more into these herbal things without attaching African fetish mentality to it. I mean, what does Ifa have to do with menopause? What does even prayer have to do with it? Let me just be frank with
Can I just chip in there?
it. Yeah.
Dr. Ayodele, I seem to be having some noises in the background there. I was just thinking maybe you are already making some sort of medication for menopause there, which some of us would do. So if
No.
they could try to make
Yeah.
disruption in the background there, that would be greatly appreciated. How would you educate people who attribute alternative medicine to voodoo?
Well, we have really, really done a lot of education and awareness on that, even at WHO level, that
Right.
we have to separate fetish belief from the science of the herbal medicine. Even at UN level, we have done that. There's a paper on that that I wrote, and it came in as communique that for now, the only thing we want to concentrate on are herbs that that have substance that we can see, that we can test, that can uh, that can say this is take this dosage at this and that. We are not interested in voodoo that is unseen. For now, between now and the next 10 years, according to WHO paper, we are working on herbs, medicinal plants that that we can see, that we can substantiate, that we can standardize. Do you understand? So anybody that is associating voodoo with traditional health, the person should read up. They should go on Google, on internet, and see at what level has traditional medicine reached in the world,
Yes.
so that we can all start and grow together and embrace our natural medicinal plants and then use it for the benefit of mankind, because it heals. Menopause is not a big deal for us in the traditional medicine world.
Can I just ask you
It's
to
not a
move
big
close?
deal for us in the traditional medicine world.
Can I ask you to move close to your device a little bit
To do
because
what?
we can't hear you properly. If you can move close
Oh, okay.
to your device that you're using, and
Okay,
we keep on hearing,
what about
yeah,
now?
we keep on having these background noises. Now, how did our grandmothers in those days from the village cope with menopause? I cannot recall my grandma saying that she was having hot
Mhm.
flushes and cold sweats. How do you think they coped? Was it as a result of herbs or what?
I'm sure because I lived in the village with my grandmother, and I didn't hear her once to say that she's coping with menopause. It was when I got to Lagos that I started learning about something menopause that is worrying them. Is that they will not have menopause or hot flashes because number one, they are eating fresh food, they are having fresh air, they are exercising by walking to the farm, you understand, and they are taking the right herbs. They don't wait until they fall sick before they take their herbs. They take a lot of preventative herbs, and yes, and they eat a lot of vegetables. They eat vitamin D rich vegetables. They eat vitamin D. They eat a lot of vitamin C. They eat fruits. They
Yeah.
don't live on pounded yam and I don't know, burger. You understand? They don't
Dr.
take fast
Ayodele,
food.
I think we found the problem to the disruption. I think they're your earrings. The controller just told me it's the earrings banging against your ear.
Oh, okay, my earrings. Okay, okay. Oh, sorry about that.
Sorry about that.
So I just came back from the.
Yeah. And I'm sure if I'm struggling
Okay.
the rest of
All right.
the
I
participants are
came.
also struggling. Yes, thank you
Okay.
very much for that.
I came back from work and I just
Yes,
didn't
very much appreciated that you
think.
just come on. Yeah, fine. With the doctors, they have clinical trials for everything. What's the success rate of using these herbs for menopause?
Well, for the success rate for treating menopause with traditional medicine is very high because you know why? 80% of Africans patronize us with clinical trial or without clinical trial, and there are success stories about them. How are you going to explain some of my patients that have reached menopause, or even let me talk about the younger ones, maybe like age 23, has not the menses just ceased. And then we give her the herbs. What are these herbs we are talking about? Is carrot? Do you take carrot for clinical trials? You understand? Do
Yeah.
you take soya milk for clinical trials? Do you take turmeric for clinical trials? You understand? Or donkwa or all these things. These are common herbs that we found around us. And then some of us have the knowledge of how to combine it or to this or to do that. And then counsel the patient with right diet and exercise. They are all menopausal symptoms.
Hmm.
And it's been studied and it's there. The articles on all these things are there for everybody to see. So it's not that I'm just going to start preparing a concoction
Yeah.
for some of my clients suffering from menopausal symptoms and give to them. I practice with already evidence-based practice and then make my prescription and manage the patient. And they are okay. I have patients who have had, you understand, even after reaching menopause. I even have patients that got pregnant at the age of 58 after like 5 years menopause. And I wasn't even treating the person for menopause. She just came to lose weight. And then obesity has a lot to play in menopause. If you lose your weight, of course, you will not have a lot of the hot flashes or the symptoms of menopause if you carry the right weight. You exercise, you eat correctly, eat what our grandmothers used to eat in the village.
Yes.
If you can, you should even. In Nigeria now,
Yeah.
everybody here, they
Yeah.
will regard locust beans as nonsense. I hear locust beans to every one of us in Ghana is like you are local. And locust beans has the richest fiber in it.
Yeah.
And people in Lagos cannot do locust beans again because they think they have arrived. Do you understand?
I
Let's go back to natural things and
yeah.
and then let's start eating what we are supposed to eat.
I think we need to actually bring you back for a future program on traditional practices, and definitely because we need to learn a lot from you. I mean, you've been doing this for almost 25 years. So, and I mean, I could remember for a long time that we used to hear Quincy
Mm.
Quincy. And so it's really, really a privilege to have you on board telling us, educating us about traditional medicine. So let's hold it right there. I have a couple of women who are going to share their experiences of menopause with us. And briefly, I'll call on Dr. Comfort Momo. Dr. Comfort Momo is actually if she's here. Oh, yes, she's there. Dr. Comfort Momo, she's a retired midwife and she's an FGM expert. I had a chat with her with regards to menopause, and she was giving me some funny looks. Dr. Comfort Momo, did you ever experience menopause?
Thank you. Good evening, everyone. And thank you to the speakers. Very interesting and eye opening session. As far as I can remember, we always have arguments around this or talk around this. I've never felt any symptoms, hot flushes, night sweat, nothing at all. And I always, when I kind of discuss with my friends that have very severe or mild symptoms, I always think maybe because I try to eat balanced diet, as you've heard from Dr. Quincy, diet plays a significant role, and I try hard to eat well balanced diet, and I try to exercise as well. So all the symptoms, I've never
And
had any of them.
you never had hysterectomy?
No,
No.
no,
Okay. Any impact on your sexual activity?
not at all. I'll be who was it that was talking about the age? I'm not ashamed to talk about my age. I'll be 58 next month, and I'm really happy. So my
No
sex
mood
life is
swings.
still very good.
So no mood swings. So during the time I was sharing with you, you were probably thinking I needed to speak with Dr. Tony Magbabiola this.
I know, because like I always find it really hard, like when you complaining of headache, hot flushes, and you finding yourself vigorously. I'm like, what is going on here? Because I've never had anything like that before.
Mhm. Thank you so much for sharing with us.
Can
I-
I?
sorry.
Okay, I can ask question like, because what I want to find out from either Dr. Faye is how many percentage of us, when I say us, don't have symptoms.
Dr. Faye, quickly answer the question. How many percentage of women like Dr. Comfort Momo would not experience menopausal symptoms?
Well, one of the problems we have in this part of the world is we don't have any data.
Okay,
So considering that it's not a subject that women readily volunteer.
that's true.
Okay. All right then.
Thank you.
Thank you, Dr. Faye. Can I also bring in a lady? I've forgotten the name she said I should ask for. Mercy, if she's on, so that she can share with us. I'm not sure whether she's on. Is Mercy there? Okay, maybe she's not here right now. Can we also have Yemisi Adegbile? Is she on, Dr.
Yeah,
Yemisi
yeah,
Adegbile?
I'm here.
Yes.
Oh, good afternoon, everyone. In fact, as I'm speaking now, I'm actually fanning myself. This must be the umpteenth time I've been fanning myself. And Comfort, seriously, don't even, stop talking. This is not fair. So I actually had all the perimenopause. Funny enough, I didn't even know that was what I was having. When I'm on the tube, all of a sudden, I'll just feel that, this sudden rush. And like you said, it can be embarrassing. Thankfully, because we were caught in the UK, mostly we're caught in the UK. By the time I get off the tube, it's like I can literally, like you can literally pour a bucket of water over me. And funny enough, as a nurse, I'm a nurse by background, specialized in women's health. So obviously, I mean, I just sucked it up and I carried on. But obviously, it was debilitating. My husband would be fanning me in the bed. We'll have to change the pillowcases, and I was probably one of those that did have obviously loss of libido. But thankfully, I actually, here in the UK, we have menopause clinic. So I connected with one of my consultant friends, doctor, and his wife works in a menopause clinic. And she actually said, you know what, you need patches. And the patches have really, really helped the symptoms. Funny enough, when I used to call, I have 3 kids. So when I'm trying to call my children back then, I'm like, what's his name? What's his name? And I'm thinking that, I can't even remember my kids. And retrospectively now, those were some of the little symptoms I was feeling then. And I'm trying to remember something, and I'm thinking that, I can't remember. So, but what has helped me is that to have an open communication, especially with my husband, because the loss of libido was really, I couldn't just understand it. But in this kind of arena, we spoke about it, and I think that helped a lot. It helped him to understand me much better without complaining, so that we can walk this new phase of where I'm at the moment. And the thing is, I talk about it. Thankfully, I have friends who are about the same age, over 54s and going on to 50, and we talk about it, because when you talk about it, then we share, what you're feeling and what you're not feeling. So we share the common thing and help each other out. So I practically think that it's very important that you talk about it. When you talk about it, then there's help out there, and just kind of how would I say, access the help,
Yeah.
to make sure that even though the symptoms may not necessarily go away, but it makes it bearable, if that's the word.
Okay.
So yeah, thank you very much.
So what you're basically saying is to have a support group, a support
Yes,
network. Okay.
very important, very important.
Lady was meant to be on board. She was telling me that they had already set one up where she's based. I think she's based in Nigeria. We know that in the UK here, they're so good when it comes to support network for
Yeah,
yes
yeah.
conditions. Now, let me bring in Tokpe Imovere. She's an accountant. Maybe her own case is going to be different. Tokpe, can you briefly share with us your own experience? And thank you, ladies, the ones who have shown their faces. Other people who actually said they were going to go on, but last minute they just said to me, you know what, forget it. I don't want people to know about my problems. I said, don't worry about it. That's why we have African mindset. Tokpe.
Hello, good evening, everyone. My name is Tokpa Mevere, and I'm a friend of Anne. We were just speaking, and she mentioned menopause, and I said, "Wow, that is something you can't understand." But for me, I was lucky. Growing up, my mom being one of 12 girls, they've experienced it in different forms, and I know it's an aging process, normally between the age of 40 and 55. So I was expecting to sweat, to have headache, to do everything I'd seen my aunties do. But maybe because of the diet or because I'm in England or different social factor, I started at about the age of 47,
Mm-hmm.
and I wasn't sweating, I wasn't having headaches, but it was a different dimension. It was more um, like mood swings. The first was thinking I hadn't locked the front door, and I will go back and forth. Going to bed, I would forget that I'll check the cooker twice. The worst day when I had to then refer myself to the doctor was when I was traveling to Nigeria. I live in UK, and I was going to go after work. So I packed it the night before, so that when I came in the next day, I picked my bag because it was a night flight. And this thing started again. He told me we had a break-in. My suitcase was taken downstairs in the living room. So this was 2 a.m. I got up, picked up the suitcase, up into the bedroom. I was sleeping, and this thing said again, you woke up and you fell over the suitcase and broke it. So I took the suitcase again into the kids' room. Then the thing said, um, you've taken your passport to work and your bag was stolen on the train. At that time, I said, get thee behind me. What is all this about? Because it was already 4 a.m. and I was back and forth all by myself. So I had to go to the doctor. I said, I get very tearful lately. I don't sleep well, not because I don't want to, but the events that have happened during the day now exaggerate themselves in my sleep. And as such, it's sad for me to come for self-referral for psychiatric treatment, but I think I have to now because I've had to contend this for over a year.
Mm.
And then the doctor looked at me, looked at the age, he checked everything, started asking more medical questions because I'm a healthy person. I don't smoke, I don't drink, and the last child was way back. He said it could be menopausal. I said, no, it can't be because I'm not sweating. I've read so much about it. I've talked about it with my mom. I've asked what year she started. She told me that menopause depends on how early you started your period. I said, so I started my period late, so 47 is too early. I was the one telling the doctor and answering the question. So the doctor smiled and said, yes, 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 you've read so much, but I tell you, there are no two women that are the same. And the fact that your mom's told you is probably helpful because you're prepared for it. But the difference is, this is it. It's menopause, and you are writing a different book, very different from your mom or her sisters. Said because you are just one half of her. You have your dad's talk and your mom's talk, and she's got her own. So you're having yours. Ah, I thought, So he said to me that when the voices start, I should just, like I do, have a presence of mind. When I lock the door, check that the door is locked. And so when the voice starts reminding me you haven't locked the door, just say, I've locked the door. So I noticed a lot of, after that, I started looking at other women, and I noticed a lot of women speak to themselves. So when I see them speaking to themselves, so maybe she's menopausal, because I was beginning to do it. Um, when I've locked the door, I'm inside Sainsbury's, something says to me, oh, your purse is on the seat. I look in my bag, it's in my bag, and I say to myself, stop this. You know, so I had to contend with that for almost 5 years, but it's over now. And I think it's a time where you can pick up a hobby or other things. But the most important thing is knowing it's menopause and having presence of mind.
Thank you.
Thank you for listening to me.
Thank you so much for sharing with us, Dr. I think the last person who wants to share is Ayo Olaosho. Briefly, please. Ayo Olaosho, you just want to share your experience with us?
Thanks for having me, Fumi, at the very last minute. Um, my experience of menopause is very severe. I started very late in life. I know that. I was in my 50s when I started, and it wasn't easy. After a year into menopause, it was exactly 2 years ago, this month actually, I started bleeding heavily. There was no explanation for it. It was a very heavy bleed. This is not a normal period, nothing like that. It was very scary. I approached my GP. They were very brutal. The first thing they said was it could be signs of cancer. So it wasn't a very good experience. But at the end of the day, it was all down to menopause, that some women just can start bleeding intermittently after, mine was after more than 18 months into menopause. And that went on for a year, heavy bleeding before it finally stopped. This wasn't period bleeding. This was just blood coming out in chunks. So yes, it left me very drained mentally. I became very nervous because always checking myself, not knowing what's going to happen next. It wasn't a pleasant experience, but they put it down to menopause. Yeah.
Thank you so
And it
much.
just stopped.
Thank you so much, Ayo. Dr. Faya, I just want to ask you, how long is this menopause? Because I started in my late 40s and I'm going into late 50s and it is terrible. How long? I saw somewhere for
Well,
you.
well,
Some 30.
there isn't any, there's no answer to that,
Wow.
because every woman is different. Um, some would have it for 5 years, some for longer, some for shorter. So there's no standard. Um, what's important is whether or not how well you're coping with it, whether it's disrupting your routine, your activities, your productivity, and if it is, then perhaps you need to see a doctor for a solution that will be specific for you.
I think also because I've decided not to take any form of medication. I rather go with black cohosh or primrose oil or what do I take again? Wild yam. Uh, there's this tablet they sell at Holland Barrett. It's called Wild Yam and sage, red clover. I don't know whether this works. So we're still going to talk about the myths and the facts later on. But that's just my own story. Last but not the least on the panel is a counselor. We're going to bring this lady in. She is a licensed professional counselor in the state of Illinois in the United States of America, a board certified counselor by the National Board for Certified Counselors. She has a PhD in counseling with a concentration in studies of advanced human behavior from Capella University, Minnesota. She has a master's in counseling where she's currently the only certified employee assistance professional in Nigeria. I don't know what that means, but she's going to tell us. Now, she has experience in the diagnosis and treatment of mental and emotional disorders, psychoeducational techniques aimed at the prevention of such disorders, consultation to individuals, couples, families, groups, and organizations. She is a certified crisis intervention counselor and certified clinical trauma professional. She specializes in depression, anxiety, self esteem, work related issues, anger issues, relationship, family issues, abuse, trauma, and all the rest of it. This person is a member of the Chi Sigma Iota, a counseling academic and professional honor society international. She's also a member of the American Counseling Association, National Board of Certified Counselors, and the Employee Assistance Professionals Association. Welcome, Dr. Bolanle Odulate Ogunubi.
Thank you very much.
Dr.
Thanks.
Bolanle, everything I read there is so American. And then you are taking such American mindset to your people in Africa with all this depression, intervention, all the words that to them they think, oh my God, I'm probably going to see a psychiatrist. How do you get over that mindset?
Very tough, but it's at the initial stage. The moment they come in, they find out that it's not what they thought it was, and then people tend to relax and be receptive of it. So initially, I was thinking to myself, what am I going to do in Nigeria? Nobody's really into all of this. They'll rather talk to pastors or imam and things like that. But people are beginning to realize that there's more to psychology and emotions, and they're more receptive of what we do. But our culture, again, like we have said, doesn't really permit that. They come in with a little bit of, they're pessimistic about it, but they get the help they need and then they change their mind. So it's a totally different situation, but it's getting better.
So, how do you deal with this mindset then? How do you make them feel comfortable about their problem?
Well, like I said, is when they come in, the word of mouth, and then we're doing a lot of awareness now. We're creating awareness, and then the COVID has really helped because during the isolation, a lot of people were feeling a lot of things that weren't physical, the emotional stuff. So that has really helped. And then we've been out there doing a lot of webinars to let them know, look, your mental health is important. You need to talk about your psychology, talk about your emotions. So people are beginning to be receptive. And then the new generation, because they're so enlightened, most of them are online and they see different things. So you will find out that the younger people tend to seek help more than the older people. But with the older people, I think it's getting better. It's just a little tough because the last thing that you want to really change and the most difficult thing to change in any human being is the cultural norms and then the perspective of the human being. You can change policies anytime, but you can't change culture. So that's really tough, but with work and enlightenment, I think we'll get there.
It's funny you should mention about mental health because within the African context, the moment you mention mental health, they already imagine somebody walking around naked.
Mm. And that's why most of the time, I personally and some other people use the word emotional. I try to change the word a bit. I'll say your emotional well-being or your psychological well-being. I rarely use mental health just because of what it connotes to a lot of people. The next thing they'll think of is yaba, palsy, or all of these negative things that they've named psychiatric hospitals. So most of the time when I want to even give a seminar or give a training, I'll use psychological well-being or emotional well-being. So just to get them a little bit more relaxed about it. And then when they come in, you can now use the word, but then at that point, it's not really as negative as it sounds anymore.
So what does it mean when you say certified employee assistant professional?
Okay, it's an association. What most organizations do, and I'm sure in UK you have it, but in the US, major organizations have to have employee assistant professionals to help their employees. So it's a mandated thing where the employees can have, it's like a wellness program. So they can have not just, most of the time they'll provide physical insurance for physicians, and then there isn't anything taking care of the emotional part of it. So now they mandate that most organizations have employee assistant program professionals that can come in and do the mental or emotional and psychological well-being of the employees. So if an employee is in an organization that has signed on for it, you don't have to wait for it. You could just call without going to HR or letting anyone know your business. So you call and say, I need to talk to someone. So you talk to a therapist and they can refer you for other things if they find out that you need psychological or emotional help.
Okay. What's your mode of counseling if somebody were to come to you and say that they're experiencing menopausal symptoms?
Most of, like some of the doctors have said earlier, most of what we'll do in that situation is CBT, which is cognitive behavioral therapy, because most everything comes from the mind. And that's why it's painful that the mind is being the lowest paid attention to, but everything begins from the mind. Our mind is very powerful and we don't realize how powerful it is. Even with the menopause thing, if you look at the people that are positive about it, that think positive, they're like, okay, menopause is there, it's part of life, it's going to come, and then I'll be fine, and I'll deal with it, and all of that. So if they already have a positive mindset about it, most of the time, research has shown, studies have shown that they experience less symptoms. The symptoms is not as bad as those people that are already going there with a negative mindset, like, oh, I'm so afraid of menopause, I don't know what I'll do, and all of this. So when it comes in, what we try to do again, like I said, is cognitive behavior therapy. We try to tell them, we try to organize group therapy, which has really worked. We had an incident in one of my, which triggered the group therapy thing for me in my secondary school class group. So I think we had a meeting and one of us was now talking about, oh, she's having no flushes, she's this and that. And then somebody else was like, really? I have that too. My heart palpitates. I didn't know that was what it was. So just the fact that someone mentioned it and other people were able to relate to it, it was very beneficial. And I just thought these people are already doing group therapy without knowing they're doing group therapy already. So we need to encourage people to talk. So when they come in, the first thing you want to get them to do is to be relaxed and find out where their anxiety is coming from. In the Nigerian culture, I've had a couple of women tell me they were really anxious and fearful about menopause. And one of the fear that one of them had was because, well, a couple of them was because they didn't want their husbands to find out they were menopausal. I was like, really? So because they felt there's this negative thing with it, oh, you are old, you become an old cargo. So maybe we need fresh blood or we need all of these things. So she wanted to hide that from her husband. And I'm thinking, okay, how long is this going to go for? And it was giving her a lot of anxiety. So of course, we tried the therapy, we did CBT, she saw reasons, she started thinking about it from a different perspective and she was able to talk to him and things got better in the house as opposed to the fact that it was already getting bad. So when they come in, you'll have to see where they're at. And then, like I said, the most important thing is the way you think about it. So I saw something that was very interesting to me and I said, okay, I was going to share that. You know, when you look at menopause, this is showing upside down, so that's not good. Every spelling of menopause is there. So if you break it down, it means me, no pause. I'm not pausing. Yes, you might be going through menopause, but you are not pausing. So you tell yourself, me, no pause. You keep telling yourself that all the time. You believe it. You're still going to move on. Your life is still going to continue. And I think it's the cultural things factor that affects it. Every culture that looks at women as the older they get, the wiser they are. Those cultures tend to have lower negative reactions or lower symptoms and signs. But the cultures that thrive on staying young, we have to be a younger, or they call it, there's a culture, I think in Arab or somewhere, they call it desperate age. that menopause, they say, oh, she's going through the desperate age. It already has a negativity to it. So it's obvious that the women are feeling, their self-esteem will be down because they think they're in a desperate age. The Japanese people will call it new spring. They call it second spring. So it's like a new life is a new thing. And that's why Japanese women tend to have low symptoms when it comes to menopause. Nigerian, we're torn in between. There are a few diverse areas where people accept it and think, well, it's menopause, our parents went through it, it's fine. And then there's another section where they think it's just coming to the end of the world. And those people tend to experience a little bit more of the symptoms that the people that are more accepting of it.
So, in other words, what you're trying to say is that it's very important for us to accept change. Yes, is a fact of life, and also for the fact that it's important to open up, especially with your partners. I've had some friends who would definitely never ever, share it with their partners. I could recall somebody actually saying to me to write an article on menopause, and I did. And the thing is, he now stuck that article, printed it out, stuck it onto the kitchen fridge for the wife to see it. And he was like, "What do you know about menopause?" Meanwhile, she had been, experiencing the symptoms, and the guy could see that she's changed, but she was unable to share that information with him. So, thank you so much for that. I will just quickly run through some myths and facts, and I will hopefully Dr. Faye and Dr. Panta will be able to tell me whether this is a myth or a fact. A woman should stop having sex once she's menopausal. Dr. Faye, yes or no? Yes or no?
Myth. She shouldn't.
She shouldn't.
It's no. It's no. The answer is no.
A lot of women there wouldn't find it funny. Okay. Eating African yams will stop menopausal symptoms. Yes or no?
African yams. Well, the only yam is from Ibarakwa. If it's from Ibarakwa, probably yes.
Okay. All right. I'm going to ask. I'm going to ask Dr. Panta. Maybe she might have an idea, or Dr. Adenaike. Dr. Adenaike, do you believe that eating African yams will stop menopausal symptoms? Yes or no? Myth or
It's been
fact?
said to help because apparently one of the places in Nigeria where we have the highest twinning rates in the world is being put down to their diet. And apparently this particular leaf, which they eat with a lot of yam and cassava, is supposed to have a lot of estrogen. But unlike Dr. Faye, I can't tell you what particular type of yam because there are different ones.
All right. Okay.
Certainly,
Okay. Since it's an African thing, what about you, Dr. Ayodele? Yes or no? You can eating African yams to stop menopausal symptoms.
Oh, yes, you can eat African yam to stop menopausal symptoms.
Yeah.
You can eat African yam to stop it. And it is our own yam. Either
what
the
type
new
of
yam,
yam?
What type of yam?
either the new
The
yam,
new yam, the old yam, the
Emura,
cocoa yam.
the cocoyam especially.
Okay.
Cocoyam especially.
Okay.
Not the white one, no, the red one. Cocoyam especially. You can use it to stop the menopausal symptoms.
Okay. Thank you very much. Dr. Panta, you can never fall pregnant when you are menopausal.
That's not completely true. In as much as your periods can stop and then you can think they've stopped and then you could ovulate. So women who go, particularly young women, go through very premature menopause, have about 10% of conception, but it's very unusual. At that age, most women who do menopause at a normal time anyway have a very low risk of falling pregnant, even if they were having periods. But it's not impossible.
Okay, right. Dr. Faye, to avoid severe menopausal symptoms, hysterectomy is the best solution.
No, not at all. Hysterectomy is not a solution for menopause, not at all.
All right. Okay. Still stay on there with me, Dr. Faye. Menopausal symptoms is hereditary.
No, it's no, not at
These
all.
are things coming through for me. Right.
Okay.
Too much
No.
medication can cause menopause.
Too much medication. What? Not normal medication, but I mean, like we said before, if you've been on cancer treatment, yes.
Okay. People living in rural areas can never experience menopause.
False.
No, false.
False.
Okay. Would you subscribe to that, Dr. Ayodele? People living in rural areas never experience menopause? Yes or no?
Well, with all my years in the village, all the people there, I've never heard them talking about menopause. So
Okay.
I think menopause is an English disease.
Okay. Okay. Herbal remedies are better than modern.
Urban one.
Is that true? Herbal remedies are better than modern medicine, even though we don't have verifiable evidence. Would you subscribe to
No,
that?
you have verifiable evidence.
We do.
I thought herbal medicine are better than any other
Or
medicine
would you say
for,
we
for
should?
the management of menopause.
Okay, the
For the
doctors.
management of menopause,
Okay,
yes, they are.
okay. Some doctors will not agree with you. We'll leave it there. So, Dr. Panta,
There's no evidence.
menopause is linked to incontinence due to frequent urination at night. Dr. Panta, yes or no?
Menopause is related to incontinence, and it can be related to passing urine more often at night, and that's because the bladder has lots of estrogen receptors. So after the menopause, it's weaker. So that's true.
All right. Menopause can cause changes to a woman's voice. Dr. Panta?
I haven't particularly heard that, but I know as we get older, our connective tissue does change and our voice does change. So I suppose in the long term, it may be a long-term menopausal problem.
Okay. Facial hair develops during menopause. Dr. Adenaike, is that true?
Facial hair can develop. Yes, it can.
Okay. All right. Dr. Faye, menopause is a personal matter which should not be disclosed to a third party.
Capital false.
Okay. Dr. Faye, menopausal symptoms disappear once you are over 55 years of age.
No, I wouldn't put an age on it, because some women will still experience symptoms even till they're 60. But so I can't put an age. That's a very individual thing.
Yeah, I'm a living witness to that. On the north of 60, I'm still huffing and puffing every night. Now, is there a link between caffeine consumption and menopausal symptoms? Dr. Panta? Is there
I
a
think there probably is a link to excess caffeine consumption and menopausal symptoms. So people often describe, in the morning they have a hot shower, they drink a coffee, a hot drink, certainly hot drinks are definitely linked to worse hot flushes.
All right.
Other things are rushing and emotional things like arguing, being flustered. Those will all make your hot flushes worse.
Okay. What about eating spicy food, Dr. Faye?
Yes,
You
it
can
does.
do it.
Yes, it can trigger hot flushes.
Okay. Menopause is a natural process. Every woman must embrace it. Every woman must experience it. Is that true?
Yes, like we said earlier, if you live long enough, excuse me, it comes to all women.
I'm not sure how long.
Okay, so that the answer is yes.
Okay, let me just quickly take some questions again from the chat box. The first question is to Dr. Ayodele. I think we know the answer, but let us speak. You look so young for 61. What do you use? Is it just herbal remedies? You don't go to people like Dr. Faye at all.
No, we have collaboration. Okay. I use my herbs, and of course, there's collaborations now between us and the Orthodox medicine practitioners. So there's not that I don't go with them. We have our limitations and they have theirs, but there's collaboration. We work together for the benefits of the patient anyway. But for me, I'm a natural person. I'm a naturopath, and I use my herbs, religiously. I don't have hot flashes. I don't experience too many wrinkles, and my blood pressure is perfect. My sugar level is normal, and there's something in the Bible that says, "Physician, heal yourself." So I thank God for how far He has done me. But then for myself, our field and the other field, there's a document from WHO that we should, collaborate. And I am advocating for integration so that for benefit of
That's
mankind.
fantastic.
So we all know our limits. Of course, if I need to go to Dr. Fayette, I will go. In the case if I have to do surgery, I can't use Skype to do surgery. I still have to go to him. Do you understand? Okay.
Fantastic. Okay. So there is a question here. What can you do when you suddenly have heavy bleeding? Is IUD a good way to treat heavy bleeding? And then the person says LNG IUD to be precise. Would you understand that, Dr. Panta?
Yeah, so there's a particular IUD which is called the Mirena coil, which is a hormone coil,
Right.
and it's inserted into the womb, and it secretes a very low level of progesterone, which is a copy of progesterone, which
Right.
thins the lining of the womb and it stops heavy bleeding. So it's really helpful in the menopausal years, because in those years you may otherwise get very heavy irregular bleeding, and it's a much lower systemic dose of the drug, so it's much less likely to cause side effects than taking the equivalent dose orally that would have the same effect on your bleeding.
All right, then. Thank you very much for that. Dr. Ayodele, I have a question here. Which herb is donkwa in English language? Or would you? Oh, you.
Donkwa is a Chinese herb,
All right.
and that's just the name.
Ah,
It's donkwa. It's a Chinese herb,
actually.
and we use it to increase the libido of menopausal women or anybody that is of age that is aging. Donkwa is it's a Chinese traditional medicine herb, and it's documented, and there are a lot of articles on it, and there are so many things you can do when we are talking of menopause. But I wouldn't even go directly for menopause, for Donkwa for menopause. What I would go for that is it's been documented fully with evidence is black cohosh, and that is not in the other practice. It's black cohosh and soya milk. If you don't have fibroid, if you have fibroid, you cannot take soya milk. But if you don't have fibroid, you should take unsweetened soya milk if you are on the fat side. It takes care of it within a month, and then it becomes a thing of the past. But Donkua is for people who are suffering from lack of libido, more of that. It's not highly indicated for management of menopause. Rather, it's the black cocoa that is fully indicated in the traditional medicine world for menopause, and we use it and it works.
Okay, thank you very much for that. Dr. Panta, how effective are black cohosh and evening primrose oil?
Those are, I'm actually here representing British Menopause Society, and on our website, we have a section on non-medicinal, so sort of herbal medicines, so non-prescribable, I mean.
Yeah.
And black cohosh there is some evidence for that. There is evidence, quite good evidence for red clover. Evening primrose oil, we tend to use that for mastalgia, for breast tenderness. I mean, I think all of these herbal remedies are worth a try. And very often, by the time someone comes to see me, they've actually tried lots of these things. So I think what we're hearing today is that there are very many different experiences of menopause.
Yeah.
It's not that some people have just a better mindset. I think some women physically experience it very differently, and the mindset will help. But I think it's like lots of things in life. It's a very different journey that women have through the menopause. It's not that some people are weak because they have bad symptoms. It's just their physiology.
That's right. Thank you.
I mean, it's a shame we don't have more research in women's health. We need more menopause studies of basic HRT, but we certainly need bigger studies of alternative therapies as well, so that they can become more mainstream.
Yeah, thank you. Just one or two questions I'll take. Do fibroids still exist in a menopausal patient, Dr. Faye?
Yes, if a woman has fibroids premenopause, they, they don't just disappear. It is said that over time they may get smaller because of the lack of estrogen. But the kind of fibroids that we tend to see here are so large that going even well into the menopause, you don't notice an appreciable reduction in the size.
Right. Okay. One last question here. What are the side effects of Mirena? and IUCD. Who wants to take that?
I'm happy to
Okay.
take that.
Please.
I mean, it's the thing I was talking about before. So the Mirena is the hormone coil, and it has in it a copy of progesterone, progestogen, levonorgestrel, and some people have progestogenic side effects to that. So that would be sort of fluid retention, mood change, greasy skin. A lot of people are absolutely fine with it. It's actually a really low dose, but there are a subset of women who are very progestogen sensitive, and they'll get symptoms with the Mirena and other forms, the progestogen part of HRT. So they're the very difficult group to treat if they need HRT.
All right, thank you so much for that. I think I've taken all the questions that I've got in my chat box there. What I just want to say is that I'll start with Dr. Faye. Any final message on menopause? Just one or two sentences. Any final message on menopause?
Yes, my final thoughts are this is a wonderful program enlightening women that menopause, women don't have to suffer because they're going through menopause. Um, Help is available, uh, be it through orthodox medicine or through non-orthodox herbal remedies. But there is a solution. I believe there's a solution for every woman. You just need to reach out to the right places.
Thank you very much. Dr. Panta?
I'd like to say that with increasing life expectancy, menopause is now no longer an end of life event. For many women, they're going to live till they're 80 or 90. It's a midlife event. And it's really important that we live the rest of our life, the second half of our life, healthy and strong. And so if you need help, yeah, I agree, reach out and get the help that you need so that you can maintain good health in your later years.
Thank you. I need to take this question because it's from a gentleman. Mr. Joseph Omunde. Can you unmute yourself, please? And make it very brief. Yes.
I'm a gynecologist and I have a big interest in this matter.
Wow.
And I've listened to you all along.
Yes.
There are three things I want to say which are very important from the presentation today.
Yes.
We published a paper called In a Name. You've used HRT all along. That's the problem for women. It is either it's estrogen replacement therapy alone for women who do not have a womb, or hormone replacement therapy for women who have a womb who need a progesterone. And you've heard from the representative from the British Menopause Society that if you had to use the progesterone, you should use the Mirena coil if you can. The reason is that the progesterone is the one that makes HRT dangerous because the breast cannot handle it. The issue of the belly has nothing to do with fat. Most women, 3 to 4 days before their periods, will swell up, and the day of the period, it goes down. Fat cannot disappear. It's because everything just goes slack. The only dangerous estrogen is the tablet estrogen, and it's no more dangerous than the pill. If you use patch, gel, or implants, it will not harm your breast. If anything, it protects your breast, and we have a paper in the process. And the most important for you is that there is no link between estrogen and ovarian cancer. If you worry about breast cancer, it protects it. Ovarian cancer, no relationship, because the ovary cannot harm itself with the hormone that it makes. Thank you.
Thank you very much for that. Very much appreciated. Wonderful contribution there. Now, I know that somebody just said to me, how do you get rid of fibroids, even if you're menopausal? Dr. Faye, quickly.
Well, there are a number of ways in which you can get rid of fibroids. I mean, I think that's a question. My one short answer is see a gynecologist.
Okay, all right. Thank you very much for that. Final thought, Dr. Ayodele, on menopause, briefly.
That let all of us women know that menopause is not a disease or an illness. It's just a natural occurrence that all of us will experience. So let us prepare ourselves for it. And I will beg our men, because it is the men that is making the women to feel that something bad has happened to them. Because I've had cases where husbands have come to drop their wives in my clinic. What's the problem? She will say that she has reached menopause, so he has to take a second wife. That's because she's old. So they attribute, no, men now attributed men experiencing menopause with old age. And that's not it. So we beg our men to accept us when we reach menopause, that is just a natural occurrence that we have to reach. And they should encourage us during the process so that at least we don't run mental with it, so that there will be no mental case. That's the main cause. So husbands normally drop their wives or dump them at home, that she has, once the woman tells the husband, I've reached menopause, they'll say, okay, she's old. And then they go and reach for second wives. So men have a lot to play. Thank you.
Thank you so much for that, Dr. Ayodele, because I might as well just quickly chip it in that next week we'll be focusing on the men, erectile dysfunction. So we'll see how they're going to cope. Dr. Toyin Adenaike, final thought.
Yes, thank you very much. One thing I want to say is that we should encourage our women to come forth with their symptoms. As everybody else has said, it is natural, it's nothing to be ashamed of, and there's a lot of help out there. The second thing I want to say, putting my GP hat on, is women should also remember all their symptoms are not always menopause. There are lots of other problems that happen to women around this time of life. And so it's always important to come with their symptoms so we can weed out what is what. And finally, for our environment, one thing we have all forgotten to mention is calcium and vitamin D. I think we are now more conversant of the fact that, especially in Africa, we always assumed that we had a lot of vitamin D. Yes, we have the sunlight, but we all live in screened houses. We drive cars that are blackened out, and so on and so forth. So as much as our diet and exercise is important, we mustn't forget the calcium and the vitamin D. Thank you.
Thank you so much for that. I think I've taken your final thought to Dr. Panther.
Good. Yeah.
Sorry?
Yeah, that was, I did, you gave me the opportunity to say it was a midlife event. That was my final thought, but I'm really grateful for the opportunity to participate in such a good, diverse discussion.
Thank you so much for stepping in at the last minute. Thank you so, so much. Dr. Toyin, we don't really want people to start thinking we're mad. So your final thought.
Thank you so much for having me. My final thought is keep positive. Positive mental attitude is very important. If you have any symptoms, please go to your doctors. Things can be discussed and things can be sorted. Love the journey, enjoy the journey. Menopause is not the end of the line. Thank you.
Thank you. Dr. Bolanle Odulate.
Thank you very much. Just like Dr. Toyin said, we can never overemphasize positive thinking. So as much as all those things come at us, try to be positive about it.
Right.
Exercise. You need that hormone as the estrogen is decreasing, increase your happy hormones by exercising and balancing it out. Again, it's just the beginning of a new phase of your life. Enjoy it.
Right. Thank you so much. I really want to thank everybody for attending the discussion program today. I don't take it for granted at all because you could have been doing something else. And special thanks to the panel, Dr. Faye Iketubose, Dr. Quincy Ayodele, Dr. Toyin Adenaike, Dr. Toyin Magbagbiola, Dr. Bolanle Odulate, and of course, Dr. Kate Panther, who came in at the very last minute. Thank you so much.